Well, as James said, my name is Karine Leblanc-Gagnon. I'm an information analyst here at the Council, and I'm talking to you today regarding the population health profiles. So a bit about the agenda for today. First, I'll tell you who the NBHC is. I'll tell you all the details about the profiles and just some of the data highlights that I wanted to share with you to give you just a brief appetite of what you can find in the profiles. First, the Health Council. The New Brunswick Health Council has a dual mandate. So the first one is public reporting on health system performance. This includes population health reporting to ensure the services meet the population's current needs. The second part of our mandate is engaging citizens in improvements of health services quality. Currently, our structure at the council is 12 council members and 16 wonderful staff. The population health profiles. They're a tool that we designed to help develop a shared understanding of the unique realities of each community and health zones. On our website, you can find two complementary ways to understand population health in a community or zone. And together, we call these the population health profiles. The first way is by looking at the data. We have an agglomeration of over 400 indicators from various sources organized by the population health model, and where feasible, available by age groups. We use administrative data such as information from either Vital Stats, the DAD, a variety of other government entities database in education or social development, etc. We also use census information, and we use a variety of surveys, some of which we manage in-house, such as the Student Wellness Survey that we distribute in all schools yearly, in here we also use the Primary Care Survey, which is a survey that we do by mostly phoning folks and saying, how do you access primary care? The value of having access to all this information in one spot for a small population group, to our knowledge, is very unique to New Brunswick. It's not often, or we haven't found anywhere else in Canada that these analyses have been done for small population groups such as our communities. We have communities as low as 5,000 in population, so this is quite a feat to be able to report on the population health of this group. We've been publicly reporting and updating these population health indicators by communities since 2013. Initially created in a PDF format, we had over 3,000 requests for paper prints for the population health profiles over the year, which we were pretty surprised at because this was not initially a tool designed for paper distribution. Instead, it was just supposed to be a series of PDF report on our website. This is to this day the product that has had the most paper requests at the NBHC. But as you know, times have evolved, and we're trying to evolve with those times. So all our information is now available through our website. It can be viewed on the web or downloaded in a PDF or CSV format. And we're constantly working at updating this information, the metadata, and the visualizations for all of these indicators. For example, you can now visualize each indicator on our website in a graph or a map format. This is new from the last few weeks. This can enable users to see trends in time or variability in geography within the province a lot easier. The second part of the population health profile tool are the observations. So these are new since this fall. We have observations for each of our geographies. So these observations are an analysis of our population health indicators to help understand how healthy we are today and what are some of the factors that influence our health. We understand that everyone might have the time or expertise required to look at all 400 indicators for a specific geography. So this tool has been produced to help understand these pieces of information and put them together to show the picture at one point in time. These observations follow the population health model. Each document includes 3 to 4 main observations, looks at determinants of health and health outcomes, as well as a brief conclusion. An observation document has been made for each of our 33 communities, 7 health zones, and is currently available publicly on our website. The feedback from these observation documents have been so far very positive. Together with the data, this tool can provide a base for understanding of our community's population health. This is where we work closely with the Moncton branch of the Maritime Poor Support Unit, MSSU, in the creation of these observations. As you might know, the Moncton branch is one of 5 such entities spread across New Brunswick, Nova Scotia, and PEI, with the goal to promote patient-oriented research across the Maritimes by engaging and collaborating with government stakeholders, health authorities, researchers, patients, and caregivers. As mentioned, the population health profiles are available for the province, the health zones, and at the community boundaries. On the map, you can see the dark purple lines representing the 7 health zones and the light gray lines, which are the 33 NBHC communities. These community boundaries are based on the catchment areas of healthcare service establishments. I mentioned the population health profiles follow a specific population health model. This is the model we use at the Health Council to measure, monitor, and inform population health in combination with demographic contexts. This model regroups determinants of health that can be influenced by programs and policies. The determinants of health have been regrouped to show their general influence on the health outcomes, and health outcomes are ultimately measuring how long and how well we live. This model has been adapted from the University of Wisconsin Population Health Institute, Wisconsin County Health Rankings model. It was chosen after reviewing many frameworks and literature review on the determinants of health. It's a model that's known as having a good approach to health reporting, which is what we do here at the Council. It makes it easy to understand the concept of the determinants of health and can help identify priority issues for action. The Health Council has been using this model for quite a number of years. We realized very quickly that this model was a catalyst to be able to have a wider reach to population health information, a stronger user base from various government entities and non-government entities, as well as general acceptance from citizens. As a recent example, we were invited yesterday by Horizon to present the population health information to a specific municipality. After the presentation, discussions around the data, next steps, etc., the mayor wanted to speak about the model specifically. He saw it as extremely valuable in helping him understand all the elements happening around in his population. In the next slide, I'll be showing you an overview of the population health profile by each of these factors. Today, I chose to show you the data for Zone 3, Fredericton River Valley area as an example. I could have chosen any place, but I think most of you probably reside in Zone 3, so I'm just trying to share some knowledge about your area. For each of these elements, I'll be covering mostly what sticks out when I look at the profiles when we compare it to the rest of the province. So comparing your zone to other zones or the province. If you wish to have the complete picture, I invite you to check out our website and everything is there. So from the observations document that we worked with the MSSU, here are some of the main observations for Zone 3 Fredericton River Valley area. So first, this zone has a relatively diverse population. Although adults and seniors are the most optimistic about their health, they feel the most isolated. The education level of residents is generally high, and the median household income is one of the highest in New Brunswick. The residents in these zones are the least satisfied with the health services received. So now I'll be going through all the elements in the model, but first, as I mentioned, demographic context is something that is always important to keep in mind. So let's go straight to that one first. So Zone 3 generally has a younger population, and we see this by looking at it has the highest birth rate, a low death rate, and the lowest median age of population when you look at all the numbers compared to all the other zones. It also has the largest immigrant population in New Brunswick and the lowest proportion of youth bilingualism. As you see, I'm not sharing a lot of numbers. I'm really trying to just keep it more general. If you want more specific numbers, you'll either have to go look in the observation or on our website. I've included for this presentation a few maps because I do like doing maps and I find they show a variability in geography very easily. For here, when you're looking at a darker color on the map, it means a higher number. So I chose to show you the median age of population by health zones. So you can see that in New Brunswick, the median age is 46 and Zone 3, which is right here, is at 42.8. This shows where the older population tend to be as well. Moving on to the social economic factors, the points of interest for this section are within the family and social support. So we have youth sense of connection with their school is the least favorable in the province when looking at all the zones. You also have the highest percentage of citizens who feel some of the time or often a lack of companionship, left out or isolated. Still within social economic factors, a few things stand out when looking at Zone 3 compared to the province. Regarding education, you have the highest percentage of kindergarten readiness. So that's the little tests that, or playtime, you could call it as well, that kids go and do before registering, when they register to kindergarten, just to see how ready they are to start school. It's also the highest percentage of youth with above average or excellent academic performance, and the highest percentage of population with diploma or degree from 25 to 64 years old. And regarding income, it's the household incomes among the highest in New Brunswick. The map I chose to show you here is the kindergarten school readiness for students with appropriate development. When you can put an interpretation to the map, I try to put the darker colors as maybe areas of focus a bit more, and the lighter colors areas that are doing a bit more, a bit better. Here you can see this is a community map compared to a zone map, and you can see within the health zone, there is still a strong variability in numbers. If you look at your downtown core in Fredericton, you've got a 93% of kindergarten school readiness versus more in your Perth Andover area might be more at a bit lower at 77%. Next comes physical environment. So for the built environment, the Fredericton River Valley area has one of the highest percentage of adults and seniors who walk or bike to work. It is high when you look at everyone, but it is still at a 5% rate. In addition, 3/4 of residents live near a park, and a high percentage of residents participate in outdoor activities near their home, the highest percentage in the province. When looking at the natural environment, the zone had the highest number of boil water orders that happened provincially in the year that this data was last updated. So the map I chose to show you here was just the public drinking supply violations. In total, there was 25 in the last data year we got, and 13 of them were in Zone 3. When we move on to the health behaviors of Zone 3 residents, they're generally good. A higher than average percentage of adults and seniors eat at least 5 servings of fruits or vegetable daily. That's higher than the New Brunswick average, but as you can see here at 44%, it might not be what we would hope for as a population. In terms of physical activity, a higher percentage of adults get the recommended amount of moderate or vigorous physical activity, which is higher than the rest of the province average here as well, but it's at a 55% rate. This area has the smallest percentage of youth, adults and seniors who drink heavily. However, 1 in 10 adults or seniors use cannabis daily, which is the highest proportion in the province. The chlamydia rate is higher than the provincial average among youth and in the general population as well. Here's an NBHC community map of citizens who report using cannabis every day in the last 12 months. Similar to the previous community maps, the darker colors show areas with higher percentage. So here, your 3 communities in Zone 3 who have the highest percentage are Douglas St. Mary's Doketown area, Perth Andover Plaster Rock Tobic area, and Oromocto Gagetown Fredericton Junction area. When we look at access to health services, only 80% of Fredericton and River Valley area residents reported they have a family doctor, which is the lowest proportion in any of the health zones. When looking at the reasons for using services, we are seeing that the seniors have a higher rate of hospitalization for an injury compared to the rest of the province. As for experiences citizens have with the health services, those who do have a family doctor report relatively good experience. So the vast majority of residents who have a family doctor said that verbal information related to their condition or prescription is easy to understand. Residents also reported that they have a very good experience with their family doctor, including the fact that he or she always explains things in a way that they can understand. And there's enough time to talk. They also feel consulted in the decision-making process related to their health. However, when it comes to rating health service received, this zone has the least satisfied in any of the New Brunswick's health zones. Only 61% of residents gave the health services they received a positive rating. So here the map I chose to show you is citizens who provide favorable rating for an overall healthcare service received. Finally, we can look at the health outcomes. Ultimately, we all want a long and healthy life. What stands out in the quality of life element for this zone, it's a small percentage of low birth weight babies in New Brunswick. They have low percentage of youth that's satisfied with life. So it's a life satisfaction here in youth is the lowest in New Brunswick. It's the highest percentage of citizens who rate their health as good or excellent. It's the highest percentage of loneliness in citizens, so citizens who are lonely. And ultimately, life expectancy in this health zone is 80.9 years, which is higher than the New Brunswick life expectancy at 80.7. So the map I chose to represent here was quality. It was a one in the quality of life element. So it's the citizens who are lonely. So that's based on a combination of 3 questions that we asked in our primary care survey. So the questions are, how often do you feel that you lack companionship? How often do you feel left out? How often do you feel isolated from others? So here in the communities in the zones that have higher percentage are Ahomokto, Gagetown, Fredericton Junction area, Nakawik, Macadam, Canterbury area, and Florenceville, Bristol, Woodstock, Wakefield area. I just provided you very, very high level information about Zone 3, Fredericton River Valley area. I was hoping not many numbers, just some points of interest for this point of time. So when you look at this type of information, we need to ask ourselves, why is it like this? What can I do with this information? Who else in my community or health zone should be aware of this? Are they? Ultimately, I do believe we all have a role to play to work on creating the population health picture we want to live our long and healthy life within. Since the release of the data and observations on the population health in combination where we are at in a society after going through the pandemic, we're finding folks from a variety of entities are looking for information just to help guide their plans to see where do we go from here in our organization as a society. The NBHC population health profiles are just one of those extra sets of tools in our Big New Brunswick toolbox to help measure and monitor population health. After the data elements, which we provide as a baseline, comes, then you have all the elements that are needed to create the change we want as a society if we find changes necessary in one of the areas. The elements in our population health toolbox can then be looked at again to see if the change we had hoped for has started or has been initiated, has the numbers changed. So if you're interested in what the New Brunswick Health Council has to offer, such as our tools, which we have a few more than what I mentioned here. Here I specifically talked only about the population health profiles. If you're interested in some of our data, our reports, I invite you to subscribe to via our website to our new newsletter, where we just had the first version of it this past month. We're just trying to find different ways to make folks aware of when we have data updates, when we have report updates, and any other types of updates. So that's what I had to share with you. I was wondering if you have any questions.
So thank you, Corinne. Yes, for everybody, if you have questions, please, if you could use the raise your hand feature. So if you look at the very bottom, if you haven't used Zoom before, under reactions, you can raise your hand before, and we'll proceed that way. Okay, well, maybe I'll start it off with a question.